Hello and welcome to Module 1 of the AlphaSite 9000 Technician Training, Foundations of Regulation Thermometry. In this module, I'll introduce you to the basic principles of thermoregulation that will give you the background science to better understand how the test works and how it can be an effective patient assessment tool for your practice. Regulation thermometry uses the process of thermoregulation to observe the physiological health of organs and systems. Since autonomic thermoregulation is partly determined by the functional capacity of organs and systems within the body, thermoregulation can give us insights into dysfunction and disturbance effects that are often causal factors leading to disease and disease progression. Whether you're enjoying a hot summer day or bundled up on a cold winter day, your body is constantly adapting to the environment to maintain a stable body temperature through the complex process of thermoregulation. The skin is a crucial element in maintaining body temperature. It sweats when we're hot, and it forms goosebumps when we're cold. With regulation thermometry, we can use the process of thermoregulation to assess the body's regulation capacity by measuring the temperature of specific areas on the skin. How? The autonomic nervous system influences temperature regulation throughout the body, and in response to both internal and external stress factors, it manipulates capillary blood flow to and from the skin, which results in heat emission or withdrawal from the skin's surface. For instance, in our test, we expose the whole body to cool, room temperature air. The autonomic response then causes the capillary beds to shunt blood away from the skin to the head and body core, thereby maintaining essential organ temperature and oxygenation at the expense of skin temperature. And here's the key. This autonomic response allows us to assess underlying organ and tissue health by way of skin temperature behavior. So the skin's reflection of thermoregulatory physiology provides information that can be crucial in disease process assessments. Let's take a look at how the skin is related to other organs throughout the body. Due to our embryonic development, the nerves coming from the spinal cord innervate following horizontal segments of the skin called dermatomes. These neurocutaneous pathways develop further to allow a bidirectional transmission between the spinal nerves and organs. So when the body is stimulated by an environmental temperature change and must respond to maintain internal homeostasis, impulses from underlying organs actually affect the responsive behavior, resulting in vasoconstriction or vasodilation of the skin. This phenomenon is known as the visceralcutaneous reflex arc, and it is through this reflex arc and the capillary behavior in the skin that we can envision organ and tissue health as the nervous system responds to the process of thermoregulation. In fact, it has been found that up to 70% of the skin's thermoregulation behavior is controlled by local underlying organs and tissues. Now, from what we understand about thermoregulation, the autonomic nervous system, and the visceralcutaneous reflex arc, we can construct a simplified illustration of the specific neurological processes involved in thermoregulation. When the skin is introduced to a thermal stimulus, the nervous system will send impulses from the skin to the brain, and the impulse back to the capillaries will include signals coming from the underlying organs. Each organ responds according to its own functional capacity and vitality, influencing the impulses that alter the capillary beds and thus affecting the temperature of the skin at related areas of the body. It is through this visceralcutaneous reflex arc that we can identify influences that lead to disease progression. So, by stimulating the body with cool air and measuring the changes in skin temperature, regulation thermometry gives us exceptional insights into the body's system-wide physiological health.